All right, guys, welcome to the AliDoIsWin podcast. Today, I have a very, very special guest. He is the man, the myth, the legend, Danny Bossa.
How you doing?
Danny, Danny is an admin of the TRT and Hormone Optimization group on Facebook that I've been a part of. I don't even know, maybe a year, 2 years? I don't remember.
Oh, we only let you in recently. You had applied like 6-7 times and we didn't have the request. Yeah, I remember. Yeah, at one point you're like, please, please, please. All right, let her in. And
it's
then
a
it's
process.
Like,
yeah. You know, going into college was harder. I mean, easier than applying for this group. Man, they ask for like photos and stuff. No, I'm kidding. So Danny, welcome. Thank you so much for taking the time today on a Saturday.
Welcome. No problem.
So Danny is also a fellow non-medical professional, just like myself. And you guys know my story with this. And I'm going to talk to Danny about his background and his story because he is so knowledgeable and one of the most resourceful people when it comes to anything testosterone and hormone optimization related. And there are a bunch of doctors in the Facebook group, but the conversations and the questions that come into that group, Danny can pretty much handle a lot of those himself. And he is a high in demand person in that group. Danny, can you just give us like a little background as to how you got into all of this?
Yeah. So it started, I believe it was maybe about 2010. I'm 46, I'll be 47 in February. So 2010, I haven't had my coffee yet, so I can't do the math. Take out the calculator and tell me how old I was.
All the years blur together now.
Yeah, so I was 36 years. Okay. 36 years old, and I knew something was wrong. I suspected, once I realized something was wrong, I said, I think something has been wrong for a while. You know, when you're a little bit younger, you're in denial about a lot of different things. And as you get older, you start questioning stuff and you start seeing stuff from a different perspective. And you're like, something just not quite right. And you start thinking about it more. And so I knew something was wrong with me, and I thought it might be hormonal. And I went to see a doctor, and I said, "Can I get my hormones checked out? Because I've been, exercising, and I've been eating right, and taking vitamins and minerals and supplements, and working on my sleep and my stress. And I feel off." And he's like, "Well, what do you feel?" I'm like, "Well, libido is kind of like it's there, but it's not like, like my friends will see a sexy girl and they're just salivating at the mouth and they just want to pounce." And I'm like, "Yeah, she's hot, but like, not enough, And my little friend down there was like, not really listening to me and not really paying attention. Can we arrange something over here?" And he's like, "Yeah, not so much." Just kind of giving me a actually not giving me a hard time, quite opposite of giving me a hard time. Training at the gym, and I would see my friends just growing and growing and growing, and they're just not putting in the effort I was putting in. So I said, well, maybe I just have bad genetics, and a lot of like kind of brain fog, very forgetful, kind of feeling depressed. I even once got on antidepressants thinking maybe it was that. And just like every little symptom that you could possibly think of that we now know is attributed to low testosterone. And I went to get measured, and I was below the clinical range. And they didn't even send me back my labs, and they didn't call me. It was about 2 or 3 weeks later that I'm like, "Hey, what's the results of the blood tests?" And I call up the doctor. I'm like, "Can you tell me, what's going on?" And it wasn't just any doctor. I went to the head. I live in Montreal. That's in Quebec, Canada, for you Yanks.
Hence the accent.
Hence the accent. And it was the head endocrinologist in Montreal, at the biggest hospital in Montreal. And then she's like, "Oh no, you're fine. You're fine." And, "Well, what do you mean? Can I have my labs?" And she goes, "No, they're fine." I'm like, "Well, what was it?" She's like, "Well, I'll send them to you." So she sends them to me, and then it took me a week to get back to her again because I said, this is the range, and I'm like below the range. Like I'm not even in that zone. Like I'm even. She goes, "Yeah, but you're not significantly below enough to warrant any type of treatment." She says, "And plus, you've had children, and you should be fine," and blah blah blah. I'm like, "Look, there's got to be some mistake." Went back for another appointment, and basically she had me take off my pants. I lied down on a table, and she basically held my testicles in her hand, and she's like, "You're fine. You're great, nice, healthy size, nice and plump. Plus you had kids. Like I said, you're fine. You're fine." And I'm like, this can't be. This can't be. So I was I said, either I'm fine and she's right, or she's a moron or ignorant or something. Maybe I got to find out. So I went through a whole bunch of other doctors trying to find someone that would help, and eventually found one that was willing to put me on testosterone replacement therapy. Started off like a lot of these doctors do at a very, very, very low dose, waiting, I think it was like started with the androgel. If any of you
Ugh.
guys are on androgel, stop. Stop. Maybe you think you're feeling good on the androgel, and you don't know you don't know what feeling good is. So I was
Ugh.
lathering this stuff on me, and that didn't work. And then we bumped that up and tripled the dose, and that didn't work. And then I started getting this compounded cream, and I'm slathering that all over myself, and that's not doing anything. And scared to death of the injections. And then I said, maybe I got to go that route to feel better. So I started taking injections, and that was an experience of its own because I had to lie down on a couch, and my wife would basically stick me with the needle in the ventrogluteal area, and I was like writhing like a petrified little child. Eventually got used to doing that, but always started at just very, very, very low dose. I didn't do anything. Um, and everything was very much based on labs and the numbers. Oh, this number's here and that number's here, and still wasn't feeling good. And eventually I was getting to the point is like, okay, I'm a problem solver by trade. So I own an IT consulting company. So you're like, how is this guy credible talking about this subject? So I solve problems for a living. I have very good logic and critical thinking. So eventually I was telling them like, listen, whatever the hell you people are doing is clearly not working. We're going to do things my way. We're going to use a logical approach. Okay. So we've been bumping it up the dose slowly, slowly, slowly over time and not getting a result. We need to find something that actually elicits an effect. So let's do something crazy. I'll take 200 milligrams a week of testosterone and we'll see if that does something. Because if that doesn't do anything, then maybe testosterone's not the problem. Maybe the problem is something else. So I take 200 milligrams a week and lo and behold, that started actually having an effect. So then they're looking at the labs and okay, we got to start lowering the dose. But I was suddenly, finally starting to feel better. And now they're like, okay, no, we're not because of these numbers. We got to start lowering the dose because this number is very high, and if you have this, you're gonna stroke out. You're gonna get prostate cancer, and you're gonna have kidney disease and heart attack, and you're gonna get cancer, and you're gonna need. So they kept lowering the dose, and as they're lowering the dose, I'm not feeling worse and worse and worse and worse and worse. And then it was always that challenge of going in to say, well, now I'm feeling worse. Okay, we'll give you a bit more, and they give you a bit more, and then suddenly you're feeling better. Like, okay, great, yeah, but look, your number's gone up, so we have to lower your dose. And then they lower your dose. You feel like shit. You go like, oh man, I feel like shit. Can you please just raise the dose? Okay, I guess we can give you a bit more. You look terrible, so they raise the dose, and then you come in like, I'm feeling better, yeah, but now the number, it's dangerous. And I did that for a little while. And all that time I was part of a Facebook group. I actually started in Jay Campbell's Facebook group. Shh, don't use that word.
I remember that.
Yeah, you remember that. And there were a lot of doctors in there, and they eventually all migrated for reasons I will get into over to this TRT and hormone optimization Facebook group. I went in there, and I was just dead set on figuring out how all of this stuff worked. Because obviously the doctors I was using just were clueless. It's just like, we'll just give them a shot and see what it does. But I knew there was a lot more to it than that. So I was kind of forced to learn a lot, and I started getting friends with some doctors, and next thing you know, we're having a lot of conversations by phone and video calls, and I'm asking questions. And well, if this is this and this is that, well, why is this? And it's like, oh, that's a good question. And then they get into details. So I was just kind of absorbing all the material. Eventually got to the point of figuring out how to fix myself. And once I fixed myself, like I really fixed myself, like every single issue I had was just gone finally after, and then seeing what life was like having been fixed.
Mm-hmm.
And I look back and I'm like, why is it that no doctor was able to do that? Why did I have to learn this on my own? Why is it that I was actually forced to find a doctor, learn this stuff myself, teach my doctor how this stuff actually works? Because he had a good idea how it worked, the doctor using now, but I needed to provide more info, which actually he ended up using to change his own protocol and the protocols of patients, and lo and behold, they're getting better. And I'm like, imagine that. Like I had to learn all this stuff just to start feeling better. Why couldn't I've had a doctor that could have fixed me up 15 years ago when I could have been living this life now versus gone through broken relationships, lost relationships, just feeling like I'm not good enough, feeling inferior, feeling I'm not manly enough, I'm not confident enough, I'm not strong enough, I'm not ballsy enough, I'm not masculine, manually enough. I have no, like that sucked. that really sucked. And I don't wish that shit on my worst enemy. Like, I just don't. Like having a gorgeous woman in your bed and you just can't do anything and you're sitting at the edge of your bed sobbing because you just feel like the biggest piece of shit ever. And obviously the girl just blames herself. She's like, well, it must be something in me. He doesn't find me
Mm-hmm.
attractive. And no, it's not that. So that really messed me up for a long time. So it angers me now that these doctors that have gone to medical school, and a lot of them are so pompous and closed-minded because they're a doctor. So I'm a doctor, I know everything, and they have their blinders on, and they're not willing to look at anything, they're not willing to learn anything. And it you know and I'm talking strictly on the hormone side. So let's not get into cancer, let's not get into
Yeah.
all kinds of like, no, I don't know nothing about that stuff. I had to learn a lot about this one specific thing. But this one specific thing that just seems so crucial for people to thrive, they just are so clueless. And some of the advice that's given out is so unbelievably ridiculous and asinine that I just felt compelled to say, hey guys, I'm going to teach you how this stuff actually works, which I can now demonstrate that it works. And I've befriended a lot of physicians that use these same types of methodologies and mindsets. Um, to challenge other doctors. You'll see me often finding some YouTube video of a doctor saying, "Oh, if your estrogen gets high, you grow tits," and blah blah blah. I'm like, "No, you don't, you moron."
and,
Or
and you do a
estrogen.
great impression of them too.
Yeah. So just to like dispel a lot of the BS myths that we call bro science about the subject, because most people just have it so horribly wrong. It's crazy. So just trying to stop the spread of misinformation, get people the right information that'll hopefully get them fixed up quicker, um, and feel better quicker. Is life is short, you
Mm-hmm.
know. So that's sorry for maybe a bit of a long rant, but that's
No,
how I
that
got to
was,
where I am now.
I think a lot of guys listening to this will be able to relate, especially because you started feeling this at 36. And 36 is not the age that many doctors will think, oh, low testosterone symptoms will start, coming to fruition. But you and I both know there's people in their early 30s and even late 20s due to our sedentary lifestyle and the fact that people are more obese than ever contributes to that. So
Mhm.
when you first started feeling that way, did you feel like, I know you said you had feelings of inadequacy and stuff, but did you feel like I'm too young for this?
So I started recognizing that there was a problem when I was 36, but I'm pretty sure that I had that problem pretty much my whole life. I
Mm.
just never really recognized. I didn't have, I guess, the maturity, if you will. Uh, and people are watching this will laugh because a lot of people think I'm immature, because I do get very immature sometimes. But
No, you
I
are.
didn't. I didn't have. Yeah, I didn't have the maturity to really just sit back and just take a look at the bigger picture and say, I don't think I've ever been right. Like, I don't think I've ever been what I'm supposed to be. I think I've been off maybe always. And now that
Mm.
I'm okay, I know damn well that I was never like this the way that I am now in my teens or in my 20s. So maybe it was like it was okay in my teens and 20s. And then over the course of time, it just started very gradually getting very worse. And it's just
Mm.
a very slow, gradual thing. And at that one point, I said, okay, there's a problem here, but it's that kind of took a bit of time for me to really realize. And then once I realized that, I started realizing more and more things that, you know, when you start opening up that box and start really exploring, you start to discover a lot more things. But the interesting thing is, like you're saying about the sedentary life and the diet, I was never one to just like sit on my ass and do nothing and play video games all day. I was always active. I ran long distance running competitions, cycling competitions. I did swimming. I always trained off and on in the gym. Came from a family where we always had home cooked meals. We ate healthy. I was always taking vitamins and minerals and stuff because I just felt like I needed them. I said maybe my genetics are shit, so let me, make sure that I'm not malnourished or I don't have any deficiencies. And so I was doing all those things, but still having issues. But now, obviously, today you see a lot of people that are, they're overweight, they don't eat well, a
Mm.
lot of sugar intake, and no exercise, and then they say, oh, I'm I've got symptoms of low testosterone. I'm like, no, you have symptoms of poor health is what you have. Like, get your health in order. There's no drug that's going to fix this for you. Get that in order first, and you might find out like, oh, I didn't need TRT at all. But I was already at that point that I had been maintaining good health for the longest time. And that's the other thing that people, this guys that come in this Facebook group sometimes, and they'll say, oh, if you're feeling like this, it's just because you eat crap and you're not training. And like, no, there's a lot of guys here, like, I'm training like 6 days a week and I'm eating like this and it doesn't help. And they all know
Mm-hmm.
it's diet related. You just have to clean up your diet and your hormones will go up. And it's such nonsense. Like, it's gonna go up a bit. I mean, if you've been drinking like 8 Coca-Colas and 3-4 Big Macs a day for 10 years, and you start eating clean and cutting out the sugar and whatever else, and losing the body fat, uh, is your testosterone going to go up? Well, yeah, of course, because the more obese you are, the more of this enzyme called aromatase you have, which means, and that enzyme is what converts testosterone into estradiol, which is a form of estrogen. So the more obese you are, the more of this enzyme you have, meaning the more testosterone you have winds up converting into estradiol, and the less testosterone you wind up with. So if you lean out, you wind up with less of this aromatase, which means less of the testosterone converts into estradiol, and you wind up with more testosterone. So that's a way of raising your testosterone levels, is saying, let me lose body fat. Not that estradiol is a bad thing, but if you just have so much aromatase that you're just converting it into estradiol and it's leaving you with low levels of testosterone, that's a problem. You want to make sure you've got healthy levels of testosterone. So that's one of the easiest ways, is just lose some body fat.
Yeah, but
Uh,
that's hard.
hard. Well,
That's a lot of
everything's hard.
work.
If it was easy, everyone would be walking around going like, check me out, and we're all looking great. Actually, not even. They wouldn't even be saying check me out, because everyone would look like that. It would be normal. You
Yeah.
know, it's hard, and that's why there's only a handful of people, well, a handful, but a small percentage of the population that actually looks good, because they're putting in the work, because it's so hard, and most people just couldn't be bothered. Most people will wait till there's a problem
Mm-hmm.
and then say, oh, I need to take this pill and this medication and that medication because look, I have this problem. Well, your problem was due to just you know not paying attention to any of this for the last 2 decades, and now you are where you are. So
It's the harsh truth. And people think that, we have a magic pill, or getting on testosterone is the answer. And you can demonstrate, as well as many other men, that even if you're on testosterone replacement, I mean, how many guys do you know who are on TRT? They don't even look like it according to the stereotype. People think, oh,
absolutely.
go on TRT, like I'm automatically going to be jacked and lean and have veins
Oof.
on my abs and all this stuff, when that's actually quite the contrary. You still have to do the work.
You got to do the work. I've done experiments. So just getting into this whole thing, I've had so many discussions with guys saying, "Oh, you just take the testosterone and you can eat shit and not even exercise, and you're going to grow." Because look at the study from Bassin that said that they gave these group of men 600 milligrams of testosterone a week, and they just sat on their asses and they actually put on muscle mass. Like, you don't even need to train. Steroids does all the work. So I'm like, you know what? I know that I'm a hard gainer. Let me try that. So I tried for a short period of time, taking 500 milligrams a week for sheer curiosity. And I trained. Did I gain? I gained a bit. I gained a bit. Now, was I training all out like a crazy, like Mr. Olympia? No, I was training like a typical, well, how a typical guy would train. I did it on purpose. And was my diet all dialed in? No, I would have my breakfast, my lunch, my dinner like normal. Sometimes I would skip. I would eat like a normal person, train like a normal person. I want to see if these steroids do all the work. And needless to say, all I wound up was side effects, crazy acne, couldn't sleep, anxiety at night. My libido actually went down.
Mm.
uh, ED started kicking in, and did I look a little bit better? Yeah, but I'm telling you that steroids, you need the other stuff. You know the expression, "You're only as strong as your weakest link." So maybe you've got the steroids, but if the other stuff isn't there, like nothing's gonna happen. Like literally nothing's gonna happen. I'm on a decent dose today of testosterone, and I train 5 days a week. Do I eat the way I need to eat to become like an Instagram model? No, like I got a family, I got a business to run. Like, I don't have that kind of time. I eat my breakfast, lunch, and dinner like any other guy, and I sure as hell don't look like a bodybuilder because of the testosterone I'm taking. I
Mm-hmm.
just feel better. My sleep is better. Clarity of thought is there. My cognition's there. I feel smarter. if anything, compared to before. Like the thoughts are more clear, more well organized. Libido and erections are a non-concern. Everything is just better in general. I don't get to the afternoon feeling like I got to take a nap. Like I can just work all afternoon and work even into the night if I really needed to, and it's just there. Um, but yeah, it's not a magic bullet at all in regards to physique. Physique requires a lot of attention to detail and a lot of strategy and a lot of planning, way more so than most people think. Try, try it
And
yourself out. I mean, just take whatever you can get your hands on and see if you're going to just transform into some kind of Adonis, and it's just not going to happen.
it does, and it takes years to build a physique as well. And with the instant gratification in our society now, it's really tough to get guys to understand that. But the fact that you're able to talk so openly and accurately about what you experienced and felt is very useful, because me being a woman, I can't say, oh, when I went on TRT I felt this and that, because this is what guys are experiencing.
Mhm.
And back to when you were going to all the different doctors, and you were on the table and you said the woman grabbed your testicles and said that you were fine. Is that a Canadian thing that they do, or is that normal in
I think she just wanted to see, like, if he's got a little, tiny little set of nuts here. Okay, well, there's something physical. I like this isn't normal. But I'm Italian, for Christ's sake. What the hell was she expecting? I'm
I
just
never
kidding.
heard that, though. I mean, obviously I know like the prostate exam and everything, but I've never heard like, looking, holding the testicles and being like, yeah, you're fine.
Yeah, like if they were shriveled up in like these tiny little raisins, and like, okay, this isn't normal. There's something off.
Yeah.
You there's a physical issue, right? But because they were of a normal size, um, she's like, well, there can't be an issue because they're a normal size and you have children, so you're fine.
Mm,
And I sure as hell wasn't fine. And then she wanted to prescribe me an antidepressant
of course.
and Viagra. And
Mm.
here's the thing for everybody saying, oh yeah, and I have that too. Why don't I just take the Cialis and the Viagra? Cialis and Viagra will not give you libido. Cialis and you're not going to take a Viagra and see some hot girl and say, oh my God, I need her now. I need her. I can't, I need, like, no, you're just going to be like this.
Mm-hmm.
Okay. But if you're like this and there's no sex drive, and I've been there, okay, and it's the weirdest thing. Like you're like this and you're just, and you're like, okay, so tomorrow I gotta get I didn't get milk. Shit, I gotta get milk. Oh wait, I didn't call that guy. I gotta call him next week because I gotta see if I can close it. And you got this, on a scale of 1 to 10, like she's like a 17, and you're just like, next week,
Uh,
really get together with, and but you're like this.
mm-hmm.
So it's like, well,
Rock hard.
this is not, this isn't normal either. Like I'm not enjoying this. It's like I could be doing it or not doing it, and it doesn't make a difference. You
Mm.
know.
And yeah, people can't or disassociate libido with erectile issues. Like you could have no libido and a full erection, like you described, and vice versa.
Absolutely.
And that's a real problem, especially this year, like more guys than ever, all having erectile issues, and it's due to stress, and they think it's a testosterone thing. And in our group, or your group, it's our group now. In our group, people are asking some questions that make no sense because they're trying to figure out why this is happening.
Absolutely.
Like,
Absolutely.
does testosterone cause my right pinky to hurt? And I'm like, wow, like we're really reaching now, which with
Yeah.
a lot of the claims these guys make, because I think they thought as soon as they got on, it would change everything.
Yeah.
And it didn't. And as soon as Corona hit, they're like, oh, my protocol doesn't work anymore
Yeah.
because it's stress.
Because that's the thing, is like you can get your testosterone levels up. It doesn't necessarily imply that suddenly I've got libido and erections and I'm done. Libido and erections are very, it's very mental. So if if you're a guy that you're fighting with your wife all the time and she's calling divorce and you can't pay your mortgage because you lost your job, and your mother's on her deathbed and whatever else, and I'm gonna get on this protocol, I'm gonna have libido erections. Fuck you will. Like, it's just not gonna happen. It's just not gonna happen. So, and even the guys that have normal lives with none of these things, they bring the testosterone and there's like, hey, I feel better all around, but libido erections are still kind of iffy, and I'm not sure why. Obviously, if you have a deficiency, that's an issue. So, when you're troubleshooting anything, you fix the things that you can recognize, hoping that it fixes the problem that you're trying to solve. So if you say, hey, measurably low in testosterone, let's bring these levels up and let's see what happens. And if it doesn't, well, that's one thing we fix. Let's see what else we can fix. But I went through the exact same thing, and I actually did a little kind of vlog, if you will, that I posted on my personal page, where I think it was around May or so, with the whole, like, we're on lockdown and we couldn't go do anything, and it wasn't you, and a lot of people weren't, like, now where a lot of us are, it's kind of become the norm, and a lot of us almost
Mm-hmm.
got used to it. But it was really starting to get to me that I'm not allowed to go to a store, and I got to wear this mask everywhere I go. Like, what? I can't just take my wife out for dinner like I used to, and we can't meet the friends at go have a beer, or can't go to the cinema. We can't go to the mall. We can't, like, we're not allowed. Like, the hell, You got to stay in your home, and you can't have people over, and it was really starting to get to me. And as it's getting to me, it's starting to, like, screw with my psyche. Like, my libido was kind of like going, and you know my erections weren't really all there, and I just felt kind of down and moody and depressed and just bitchy and whiny. And the first thought that went through my mind was, maybe I need to adjust my TRT protocol. That's got to be it. And then the other voice is like, no, you moron. It's like, your protocol's been fine for 2 years. And what? The protocol, like, it's not nothing to do with the protocol. Look at your life. Look at what's going
Mm-hmm.
on. Like, that's the freaking problem.
Mm.
So yeah, this is not some magic bullet by any stretch of the imagination. You need to say, how do I reduce stress? How do I improve sleep? And a lot of people are on the verge of, they lost their jobs, they're losing their jobs, maybe clients shut down. And I'm the same way right now. I got a lot of clients that are hanging on by threads. It's like a big chunk of my business. So they go down, like, I'm in trouble, and I'm trying not to think about it. But there's people that, this is a hotel owner in Montreal. He had the hotel for 30 years and said, in the last 6 months, they have spent everything that they've made in the last 30 years. Can you imagine? And he
Wow.
says, I'm about to take the keys, bring it to the bank, and say, the building is yours.
Ugh.
So this thing is going to mess with everybody. So any of you guys right now trying to solve libido and erection problems, you couldn't have picked a worse time.
Mm-hmm.
you know just get through this. Hopefully we get through this mess, and then when things get back to normal, it's
Ugh, crazy. Well, you're also open too about your experience with gynecomastia.
yes.
And I think that's obviously a very big fear of men and myth that if they go on TRT, all of a sudden they're going to get gyno, hence why they think they need to take an AI, which we'll
Yeah.
get into after. But can you talk about that and why it's really not something to be so afraid of that so many guys are?
Okay, so it's a pretty long conversation, but I'll kind of abbreviate it as much as I can. um, all the doctors, well, the doctors that started dealing with patients in regards to hormone replacement for men mostly got their information from the bodybuilders. They would go to bodybuilders to say, hey, you're on testosterone and you take it, what the impact is, and, like, what do you do to, like, feel better and whatnot, because I've got a patient that we ran a hormone panel and he's deficient in testosterone. I want to administer it, but I'm not quite sure what so a lot of this information goes told by the bodybuilders. The thing with the bodybuilders is that you'll very rarely find a bodybuilder that takes just testosterone. Bodybuilders are typically on a number of different compounds, and all these other compounds are all synthetic drugs, either
Right.
synthetic derivatives of testosterone or synthetic progesterones, or whatever else. And synthetic drugs are never going to have the same impact in the body as a naturally produced hormone like testosterone. Um, so all these bodybuilders were taking an aromatase inhibitor, which is basically a medication that prevents or blocks, if you will, that process of converting testosterone into estradiol or estrogen, which leaves you with more testosterone. So they were basically telling doctors, when you prescribe, you got to make sure that you give this aromatase inhibitor as well, because otherwise their estrogen is going to get really high. And if their estrogen gets high, well, they're going to get gynecomastia, which is the man boobs, you know, or they're going to like get emotional. They're going to cry at movies. They're going to get, you know, bitchy like a woman during her PMS, and they're going to have water retention, and they're going to have all kinds of these issues. So you have to, so the doctor's like, oh, I got to get this stuff. The problem is there is literally nothing in the literature to suggest by any stretch of the imagination that lowering estradiol in a man is good for you. Like there's just not. And that's a huge, huge, huge topic of controversy. And I get hate mail and literal death threats when I talk about this stuff.
Oh my
Because
gosh.
there's guys that have been on TRT and, you know, they run cycles for the longest time, and they say, you know, if I don't take an AI, all these bad things happen. So, you know, you're completely full of shit. Estradiol has such unbelievable benefits in the body, and people have vilified it as that woman hormone, if you will. It's going to reduce your risk of cancers, cardiovascular disease, osteoporosis, arthritis, Alzheimer's. It will increase your bone mineral density. It's a huge factor in driving libido, in erections, uh, brain function. If you get a concussion, your brain will actually produce more estradiol because it's neuroprotective. Um, there's such a massive list of benefits from estradiol. And one of the biggest ones that people don't even know is it's actually promotes anabolism. If you've reduced your estradiol levels, your testosterone won't be nearly as anabolic than if you had testosterone with estradiol.
Can you repeat that, please?
Yeah, and I say this a lot of videos. I'm gonna say it again for those of you who's been like nodding off for a second.
For the people in the back.
Yeah, it actually promotes anabolism. It actually promotes metabolism of fat. They have studies where they greatly reduced estradiol in men, and they wound up with more fat mass, more gynecomastia, more tenderness. You're bringing up gynecomastia, tenderness at the breast receptor site. Versus having higher levels of estradiol where the fat actually gets reduced and the tenderness goes away. There's a lot of men that actually have to take exogenous estradiol because they have an estradiol deficiency, basically that they're on testosterone replacement therapy and their testosterone levels go up, but their bodies aren't making nearly enough estradiol to reap these benefits, so the doctors will put them on exogenous estradiol to bring those levels up to something good. And the men that do that don't get gynecomastia. They just don't. The next thing you know, it's like I got better libido and I got better erections and I'm losing body fat. Like, how the hell is that possible? I thought that's that thing that, you know, women when, you know, the PMS and, you know, they look what happens on a PMS. Like, no, you just look at just Google what happens to women on PMS or during the cycle. At the beginning of the cycle, estrogen starts going up, and it goes up and it goes up and it goes up. And the day of ovulation, that's the day your wives and girlfriends want to jump you. That's when they're horniest,
Mm-hmm.
right? That's when estradiol is the highest. And then after that, it starts kind of going down, going down, going down. And then there's a small peak. And then on the last week of PMS, it's just tanking. And that's when they get bitchy. And men think it's the opposite. Oh, when my
Mm-hmm.
estradiol gets high, I get bitchy. No, when my wife's estradiol gets high, that's when she's like, hey, I love you. I love you.
Yeah,
Let's go have
we
sex.
feel the best.
Okay.
Exactly.
So, and there's just so many studies of what lowering it will do. The big controversy is that most of the studies have to do with lowering it too much. And
Mm-hmm.
guys are saying, well, what happens if you just lower it a little bit? And the argument becomes, well, if you're seeing that these levels, the more that you have of it, the more the benefits, then why would you want to lower it at all? You know, and that's the part that a lot of guys just can't grasp, and they're so stuck on the notion that all these side effects that they get when they're on TRT and steroids is all due to estrogen. The interesting thing is I had developed gynecomastia prior to starting testosterone replacement therapy, and I did a video of it. If you go on the YouTube channel, the TRT and hormone optimization, I think the title of the video is like how I fixed my gyno.
Yeah.
So I had boobs. Like I had a really fatty chest, and I had these big hard lumps under each nipple that were very, very, very sensitive to the touch. Just a little, if somebody would just nudge on me, they would hurt.
And this is before you were
and
on
this is
TRT.
and this was before TRT. When I started TRT, I told them immediately I wanted to have an aromatase inhibitor, also known as an AI. not to be confused with artificial intelligence, because I didn't want the gyno to get worse. And the funny thing is that the entire time I was taking the AI, I didn't lose any fat on my chest, and those lumps were still there. They were maybe a touch smaller, but they still hurt like crazy. And it was only once I started really digging into the literature to say, hey, I don't think I should be doing this. And then I was talking to a lot of physicians that they had already stopped doing it for quite some time. And they used to prescribe AIs, and they eventually stopped, and they saw the benefits and they'll never go back. So I stopped, and lo and behold, I started losing fat on my chest. And over time, that lump just started getting smaller and smaller and smaller and smaller. So like now, if I go like this, like I kind of feel like a little tiny little bump, but it doesn't hurt anymore. Like there's no pain. Like when I hold my son on my chest, I'm not like holding him like this, trying to keep him away from the lump. Like it's just gone. And I take up my shirt off now, right? And I don't, like, I was embarrassed to take off my shirt. I was training and I had like a half decent physique, but my chest just looked horrible. And I didn't want to take off my shirt. Now it's like you can't even tell it's there.
No.
And that was just by getting my testosterone levels up and getting the resultant estradiol levels up, and that's all it was. So I thought it was maybe an anomaly, and I started making posts in the group and in forums and stuff like, "Any of you guys had this same, same issue?" And they're like, "Yeah." I was like, I'm one of the biggest kind of anti-AI voices on the internet, and there's a lot of guys reached out to me, say, "Hey, I tried what you did, and my gyno's going away, and I've tried every drug like tamoxifen and aromasin and arimidex, and none of them ever helped. And now I stopped taking all those things, and I thought it was going to get worse, and suddenly it's getting better, and I don't understand."
And you didn't have the surgery?
No, no surgery.
So
No.
by raising your estradiol and
Yeah.
maintaining high testosterone
Yeah.
and eating a clean diet
Yeah.
and training and all that, it went away.
Yeah. I mean, is it completely gone? It's not completely gone. I don't think it'll ever be
You can't
completely gone.
tell though.
Yeah, because once that tissue gets formed, it's there. It's just, you don't even notice it anymore. Like I walk around and you'll never, like if you look at the before pictures that I had on that video,
Mm-hmm.
like you would never tell I was ever like that. It's just gone. So there's so many guys that I've actually convinced to stop, and I'm like, just try it. And I tell them oftentimes you may feel worse before you feel better, especially the guys that don't have a protocol that's properly dialed in. When I say dialed in, meaning properly set up for them specifically. And it's just a couple of little minor tweaks to their protocol will usually fix that. They get off, and I tell them sometimes you might feel worse before you get better. Sometimes you'll feel fine, and there's not really any difference. But a lot of them come back to me saying, I'm noticing like the weirdest things after I stopped taking the AI a couple of months later. Actually, I did a consult with a guy last week, and he says the first thing I noticed, and this guy basically he does a lot of running, like long distance running. He says a couple weeks after stopping the AI, he says I did a PR for it says a 5K that I did, or 5K or 8K that I did, because he was doing that like a couple times a week or something. He says I beat my record by a lot, and I thought it was just like, oh, maybe I'm just having a good day. And he says, and every other day I was beating it and beating it and beating it, and I didn't understand. He says, and I felt I could breathe better, and I had the exact same experience as him, not in the running, but that was the first thing I noticed when I stopped taking the aromatase inhibitors about 3 weeks in. I was like, it's like I feel like my lungs are all opened up. I don't know if it's in my head, but I just feel like I breathe better. And I'm like, well, am I thinking that is this just all in my head? I'm just make believing. I'm like, well, no, I've never read anything about breathing better when you stop taking an AI. You attribute stopping an AI with like all these bad things are going to happen, but I can breathe. Like, why would I breathe better? And a lot of people have mentioned that their libido has increased. Their erections have gotten better. Their sleep has gotten better. Their mood has gotten better. Um, so yeah, I've seen so many guys that have benefited from this, and I've got guys that I've got like hundreds, if not over 1,000 emails and messages at this point, more, of guys saying that was the one thing that changed everything for them, was just dropping that aromatase inhibitor that they'd always been taught from day one that they needed to take. And they said, I finally have all of the benefits I always wanted from TRT that I never had. And I tried high doses and low doses, and I tried this and that, and once a week injections or daily injections. I tried the cream, and I've tried pellets, but the one constant was I was always taking this aromatase inhibitor, and I took this out, and like now I finally feel the way I should be feeling.
I love that.
But you get the guys that are just, maybe are there some guys out there that absolutely need it? Maybe, but there's a lot of guys out there that told me that they absolutely needed it, and I finally convinced them, and they changed it, and they said, "Shit, you were right." The biggest thing that I get attacked for is they say this is Danny Boss's opinion, and I'm like, I didn't pull this information out of my ass. You know what I mean? Like
Yeah.
when I did that debate last week. Okay, I just have this sitting. Okay, I got like there's like 150
Stack of
pages
studies.
of data, and I knew I couldn't go through all of them, and I'm like, well, which one's the best one to present? But I could have been presenting data for like 3 hours.
Mm-hmm.
But I knew that anything I was going to provide, they were just going to say, yeah, but on that one, it's this. Yeah, but on that one, it's this. And at one point I asked them, well, do you have any data of your own to provide? And they didn't,
Of course. Of
which I found
course.
interesting. So no, guys, this isn't Danny Boss's theory. This isn't Danny Boss's invention. This is stuff that was taught to Danny Bossa from actual physicians who are telling me, hey, I used to use an AI in my practice because that's the way I was taught. But then I started reading the studies, and now I've stopped, and all my patients are getting better. So I'm never going to go back to doing that again. And frankly, I don't even have one patient taking an aromatase inhibitor. So when you start meeting about 24, 3 doctors like that, you say, hey, I'm not the only one. But because I'm that face on the internet, I get vilified as, Danny Bossa and his anti-AI cult, and he cherry picks his doctors, and it's Danny Bossa's opinion, and and he has no studies.
It's amazing. It's like, okay, you're holding a massive stack
Yeah,
right in front of you.
yeah,
And people get so worked up about it
it's
because
unreal.
of their confirmation bias, and like, they've been taking it for so long, and like same with my clients, like it's only positive things when they
Yeah,
come off of it.
yeah.
And I had a guy a month ago consult. He had low estrogen, but they still put him on Arimidex every other day, 1 milligram. I'm like, dude, and he's training for the U.S. Marshals. 1 month in, he has dropped body fat around his stomach because of the insulin resistance that it causes when you lower your estrogen. And I try to explain, like, when women go through menopause, there's a reason they get belly fat, because they have no estrogen. Hello, like, and we get very worked up about this, but the
You know how you
debate,
just mentioned insulin resistance from the estrogen, from lowering the estrogen?
yeah,
You know what causes one of the big things that causes gyno? Insulin
insulin
resistance.
resistance, yeah. It's amazing. And a doctor that we both followed, Neil Rouzier, was saying that people will come in his office and say they need an AI for gyno, and he's like, so what is gyno? And they're like, well, and he's like, no, but explain to me. And they can't, because they don't know what it is. They just hear it or read it on the internet in all the forums that that's what they have to have. And so now there's this argument too, where bodybuilders will say, okay, yeah, but that's like TRT dose. It's different when you're on super physiological doses. You have to have an AI, because otherwise you're going to get those issues. And I'm like, but is it really that different?
So every guy I know that feels the way I feel, that can genuinely, sincerely say, I'm dialed in. There is nobody on the planet that's going to tell me to change my dose right now. We don't really go by total testosterone. Total testosterone isn't really a good indicator for the stuff, but we go by, frankly, none of the labs are a good indicator of the stuff. I've learned the more I'm doing this stuff, the more I'm realizing that the labs are going to give a clue, they'll give a hint, but they're not really demonstrative of anything. Yes, if you measure somebody's total testosterone, and the range is right now is like, you know, 300 to 800 nanograms per deciliter NGTL. If the guy's at 102, okay, like he needs TRT, right? Like we know that.
Yeah.
But if the guy is at, 700, you might say, oh, he's at the top of this range. This guy must be fine. No, it
Mm-mm.
doesn't mean anything. I know guys that at 700, they have every symptom known to man when it comes to low testosterone, and I got other guys that are dialed in. It doesn't demonstrate anything. If there's a value that's really, really, really off, it might give me a hint. So if a guy's taking a big dose and his total testosterone is 3,000, I say, maybe you're having some of these side effects because maybe you're taking too much because your total is just astronomically high. Maybe you want to try bringing it down. So that might give me a hint. But a lot of the guys that are dialed in typically have their free testosterone, which is a much better indicator, at a bare minimum of 25 nanograms per deciliter. I'm finding the range of, if I take all the optimal guys I know, and I've done polls in my Facebook group and I've talked with thousands and thousands and thousands and thousands of guys at this point, and then the doctors who have all their patients, the doctors come back to me and say, what my patients, that it seems to be somewhere in the range between 25 and 60 nanograms per deciliter of free T. He says over 60, we usually have them drop off the dose with some exceptions. And if they're below 25 and they're having issues, we typically raise the dose. But that seems to be where the vast majority of guys fit. But even then, there's always going to be the exceptions. There's guys that I've worked with myself personally where I used that strategy and it just didn't work. They needed like micro dosing of testosterone, like 5 milligrams a day of these tiny little baby shots, because anything more and they'd just freak out. And it's not that it was in their head. Testosterone has a very significant impact on the central nervous system. And there's some guys that are just hypersensitive to any little bit of exogenous testosterone. Those are the guys that are really tough to work with. But yeah, the vast majority sit in that range. I'm trying to remember what your question was. I've gone
It's about
way out.
no, it's fine. Remember, I said last night we're going to have multiple tangents,
Yeah,
which I like.
yeah.
It was about how all the bodybuilders come in to defend the
Yes,
fact that they
yes,
think because they're bodybuilders they still warrant an
yes.
AI.
So when you look at the clinical range on paper, free testosterone, the upper range, I think stops at about 22 nanograms per deciliter. And that's the clinical range. I think it's like 8 or 6, I think it's 6 to 22, okay, for free testosterone, nanograms per deciliter.
Mm-hmm.
I don't know any guys that are dialed in that are below 22. So technically, they're all super physiological. So people say, well, you're super physiological, you're on steroid cycle because you're higher than the norm. Well, the norm is based on a population of predominantly sick people.
Mm-hmm.
Okay, I'm not trying to become the average of the average. Okay, that's not who I am. I want to take the minimum dose required to fix my issues, whatever that amount is. So if I take 100 milligrams a week and all my symptoms are gone, well, that's going to be my dose. I'm not going to keep bumping up the dose to see if I can get better and better and better. My issues are fixed, leave it there. But most of them are super physiological. And that's another huge controversy with people is like, no, you have to be in the range. And a lot of these doctors are targeting a number. They say, I
Mm-hmm.
get all of my patients to the high end of the range. I target the high end of the range for total testosterone and free testosterone and DHEA and vitamin D. And I get them all at the, why? If it was that simple, we could close up shop, shut down the YouTube channel, shut down the Facebook group. Like, we don't need to discuss this shit. You
Mm-hmm.
target the high end of the range. What's your number? Oh, your range is here. So we just got to give you a little more. You go there and you're going to be fixed. Done. And any idiot could be doing this. It's not that freaking simple. It's not that simple. If you're targeting a number, if your doctor is targeting a number, they are doing it wrong. End of story.
Thank
No
you.
discussion. They are doing it wrong. There is no number for anybody. My number is different from her number, from his number, from their number. Our numbers are different. How much we take a week is different. The frequency of injection we're going to take is going to be different. Some guys do better on cream because of the higher DHT it causes. Some do better on the injections. Everyone is going to be different in that regard, and there's no number to target. The analogy I like to use is you imagine yourself a guy with low testosterone symptoms, and you find yourself on a deserted island with all the syringes in the world and all the testosterone in the world. What are you going to do? Well, I'm going to figure out how much of this shit I need to take each week to feel better. And also, if I take 2 shots a week of this much, that seems to be where I feel best. I've tried more, I've tried less, I've tried more frequent, I've tried less frequent, and this is where I seem to feel my best. And that would be the end of it, and you would just go about your day. You would not be taking the lab and saying, okay, so my free T is here, but but now my ratio between my test and my estradiol, it's a little bit low, so maybe I need to take it. You wouldn't be doing this stuff. Like, you just wouldn't, and I don't either. And most doctors are saying if you're super physiological, it's dangerous. It's going to cause these issues. And in every single time I hear that, I said, can you ask your doctor to provide you the evidence that higher levels of testosterone are going to cause any kind of harm?
You never can.
There are none. A lot of you are saying, yeah, but if you take the 600 milligrams a week, it's going to, well, there's a study where they gave 600 milligrams a week to guys for 20 weeks, and there was no harm. Now, if they would have done that for years at a time, would it have caused harm? Maybe. Is there an amount that if you surpass, it's going to cause harm? Maybe. But we have no evidence in the literature so far with over 80 years of study of testosterone that it causes harm. Do synthetic anabolic steroids cause harm? Absolutely. Testosterone, we don't have it. So someone would need to do a study to determine what is the highest dose, what is the dose that someone would need to take to really cause some kind of an issue. And I simplify it a lot more, where some guys can do better, some guys can tolerate higher doses than others. I've tried doing let me try taking 500 milligrams a week or 600 milligrams a week, and I do not do well on that at all. I get every symptom imaginable. But I've got friends of mine that can take 1.5 grams of testosterone a week, and they're like, I feel great. I don't get acne. I sleep great. My libido's through the roof. I feel fantastic.
And they don't need an AI because they're on such high
And they don't
levels.
need an AI. They just don't. Some of them are just taking testosterone. I load up on this. I don't need to take anything else. I feel fantastic. I get great gains and whatever else. Now, again, guys, I'm not promoting anybody does this. I'm just using this for the sake of example that primarily the guys that are taking aromatase inhibitors are on other stuff.
Mm-hmm.
And guys that are getting gyno oftentimes are on other stuff. There's a doctor in our group, Dr. Jordan Grant, who once experimented with MK677, which basically is a growth hormone secretagogue. It basically causes the body to secrete more growth hormone. When your growth hormone goes up, your blood sugar can actually spike, and that gave him gyno. And
Wow.
he got gyno from that. Nothing to do with estradiol whatsoever. It was from the MK677. So yeah, a lot of the fears and a lot of the stuff we all been brainwashed with, most of it is wrong. And it's kind of like people get so passionate and aggressive when you talk about it, because it's almost like you're poking fun at the religion. It's kind of like you're a very devout Catholic, and I tell you, I've got all the evidence here that God doesn't exist. I mean, you're full of shit. And it's like, but no, like, how dare you? Like it's and even the ones that do eventually get convinced, it's not something that you're just going to change your mind in 5 minutes. Like, oh, the study says that estradiol is bad. Okay, well, I guess it's bad. I'm going to stop blocking it. Done. Like, this is something like the example of religion, of going from a believer to a non-believer as an example. It's not something that just happens overnight. This is like a process, and that's how the guys are with aromatase inhibitors. It's like, it's a process of going from, I don't want the stuff in my body because I'm going to grow breasts and it's bad, to, hey, this stuff is actually providing me benefits. And it gets so ingrained in your head that when I get any type of weird issues to this day, I have a little voice saying, maybe it's the estrogen. Like, no, it's not the freaking. It's unreal. Like, it's in my brain, and it's not going to go away. It's the funniest thing.
There's in Neil's course a few weeks ago, he was talking about a patient of his that started with him when he was 65, and I think his test level was like in the thousands or whatever, and the guy felt great, and he's like, he's got 3 girlfriends and blah blah blah, telling stories about him up until when the guy's 85, and he was like, he's down to 2 girlfriends, and then somebody asked a question. One of the physicians in the crowd asked, can the guy drive? Is he okay to drive? And Neil's like, he has 2 girlfriends. He jogs 3 miles a day to the gym, like all this stuff. Cause they're like, well, he's too old to be on all that. And it's so high, and all these myths. And he was going over the range of free testosterone for guys in that age range. And it starts at 0.0 to like 6 or 8. And he's like, so you're normal if you have 0 free testosterone. How do you feel about that? How would you feel about that? It's like,
Not good. Testosterone is what makes a man thrive.
yeah,
If you don't have testosterone, you can't be a man. We need that to thrive. Okay?
but it's so
And some of
scary.
the arguments are just, why don't they give an AI to teenagers? I got a 17-year-old. I can guarantee you, and because I've seen the evidence, his libido right now is through the roof. Okay?
Mm-hmm.
It just is. Like, that's probably the only thing the guy's thinking of right now is that. Okay? How come I don't have to give him an AI? His testosterone is astronomical right now. Why
It's a
are we
great
giving
point.
testosterone to AIs to teenagers? And then the doctors that say, well, when you're on TRT, you need to stop taking testosterone for 1 month out of the year because it's good for you. How come we're not
Yeah.
chemically castrating teenagers 1 month? Guys, it's October. Come here. Chemically castrate you for the month of October. It's going to be good for your health. Who do what? We don't do like some
I
of the
don't know
stuff that they
why.
come up with. It doesn't make any sense. Why would it make a difference whether you're making it naturally or you're taking it exogenously? It's the same molecule. It's going to have the same effect in the body. But suddenly, if you're taking it like that, well, now you got to take all this other medication. Well, how come I didn't need this medication when I had naturally high levels before this? In my soccer match where the guy kicked me in the nuts, and now I have testicular failure. My levels have dropped. I didn't need the AI back when I was a jock. I'm using an example of some guy.
Mm-hmm.
It's just some of the theories that come out, just you can poke holes in them so easily, and people just can't wrap their minds around them. You're talking about older guys too. Most of the doctors I talk to, they say those are the guys that benefit the most.
Mm-hmm.
The younger guys that come in that have issues, let's say in their mid to late 20s, early 30s, they're expecting that they're going to take a shot and it's going to be like, I feel like a god. I feel the testosterone coursing through my and then suddenly they realize, very soon that like shit, this doesn't do at all what I thought. Like, yeah, I feel a little bit better, but I don't feel like I'm a raging bull or something, right? It's the older guys. The older guys, when they get out, they get on HRT, they don't look at it the same way the younger guys do. All of a sudden it's like, hey, I can move again. Hey, my back doesn't hurt. Hey, I've got some libido. Hey, I went for a bike ride today and I felt better, and I had the best night's sleep I've had in 2 decades last night. This is like they freak out, and they're not wondering, well, where does my estradiol sit? Do I need like they're not asking any of those
Yeah.
questions. That's the other interesting thing to go about the AI is the vast majority of people that go to a doctor to say I feel off, and the doctor measures their hormone levels and say you might do well with HRT. Let's do a trial of testosterone and we're going to see if it helps or not. They get better,
Mm-hmm.
and they don't even know what estradiol or E2 or aromatase inhibitors, AIs. They don't know any of that shit. They've never even heard of that. All they know is they feel better, and those are the easiest patients in the world. The tough ones are the bastards like me that went to read every freaking study and learned about estrogen and DHT and this and insulin and what about my free T3 levels? What about my thyroid stimulator? Well, maybe my thyroid's too high. And then you get on the stuff and then you're analyzing all of this stuff that just completely negates the whole purpose of it. We're trying to break down. Okay, well, last night my libido was good, but the night before it was off. So could it be the estradiol? And they're just never satisfied because they've just, I don't want to say they've learned too much, but they've clouded their judgment by all this other stuff that they've think that they know how it works. When a lot of times is just get your testosterone levels to a point that you feel better and you're done. It's really that simple.
It is. It's like fat loss. It is so simple, but so
Yes.
hard to put into motion.
Yeah,
And
absolutely.
the amount of doctors that you and I are surrounded by, it's like we're not just getting this data from like some random search engine because it's not the opinion, like you said. There are doctors that are very intelligent that are doing it the right way.
Hmm.
They're just few and far between. And, you know, a good thing about COVID, one of the positives is that telemedicine now has increased so much to where we can get people the help that they need with doctors that do that, where it wasn't as easily accessible before.
Absolutely.
And
Yeah.
people ask all the time, like other fitness professionals, and I'm sure people ask you as well, like, how can I learn more about this? And it's not like there's a certification course that we took or
No.
a book or something. You have to have that conversation with multiple individuals. Obviously, the
Yeah.
group is a huge source of information,
Hmm.
but people have to take it upon themselves to learn, like you did, and be your advocate for your health to understand this is why this happens, and these are the truths, these are the myths, and not just believe what one person says. But if there's an epitome of like a second, third, fourth, or fifth opinion, it would be in the hormone optimization world,
Yeah.
you
Yeah.
know.
If you, there's a lot of guys that say like, my doctor, he's the best doctor. He's the best doctor on the planet. And he says it works like this, like this, like this, like this. Maybe that's true, but wouldn't you want to have the perspective of a few dozen physicians that are telling you a bunch of stuff? Because if 80% of them are saying, hey, I'm seeing great benefit by doing this, that's that's like that's something, that's evidence to me, right? So I don't follow the word of one particular physician. Like even Neil Rouzier we mentioned before,
Mm-hmm.
I could have some points, like if we had an online discussion, I could say, listen, I'm going to take the approach of someone who's going to be critical, and I can poke some holes in your theory, and let's see dance your way out of that one. And you know I could probably hit him with some questions that I get asked, and sometimes I don't know how to answer.
Hmm.
But I've just gotten the perspective of so many different physicians, and I found commonalities between the ones that the people are really raving about them and the ones that aren't. They're complaining. Well, these physicians all seem to be doing it this way, and the guys that are dialed in, sometimes I'll message them like, "Tell me what you're doing." And like, I do this and this and this, and I've tried this and this. So you just pick up all this, and you can call it anecdotal evidence if you'd like, because we don't have any literature, we haven't done any studies. But when you just have this amount of data being fed to you every single day, you kind of start to see how things work. So when someone says, "Oh, you're doing it like that, that's just your opinion," and you just roll your eyes, like, come sit next to me at my computer and let's
Mm-hmm.
look through. Like, it's going to take you years to go through it, and then we'll have this conversation. Then they'll go, "Oh, yeah, oh." Um, so the Facebook group is a great place. Unbelievably, we're getting targeted now by the
Police.
Facebook bastards for censorship, because now Zuckerberg is basically saying, I don't want any groups having to do with violence or health advice. No groups of health advice, or we don't want to, because they have to get it from authoritative sources. Holy shit! If I got my TRT advice from an authoritative source, I probably would have jumped off a goddamn bridge by now, frankly.
Yeah.
So now every little post, it's like, oh, it goes against community standards. One more warning, and we're going to close your group. Close your group. So the group might get shut down. We temporarily opened one on that new social platform called MeWe, only because it's a platform of zero censorship. So we're getting a lot of the guys going over to there because that group could wind up getting shut down at any time. So that kind of sucks. It's amazing how there are legit Facebook groups or legit places where you can go to where people are really eager and you know to get in the right information or to share information, whatever, and it's all for the greater good. And someone will come and say, no, you're not allowed. You can only get your information from this source, this source, this source. That shit pisses me off.
Yeah, that's frustrating. When I first started seeing those restrictions and posts, I'm like, really? It's like it's such a wealth for so many guys. I mean, how many guys in that group have said this has been a godsend? You guys have saved me. I have nowhere else to turn. I mean, we see it every day. There's posts where they're just like, I'm at my wit's end with my physician. Somebody help me. Like,
Yeah,
and now that's gonna all be threatened to be
yeah,
going away. Like,
yeah. Yeah, there's been posts that got closed for breaking community standards. One guy that said, "Hey, my doctor has prescribed me testosterone, 100 milligrams a week, split into twice. I have a question." It goes against community standards because you're discussing a controlled substance, and it's like, it's a fucking prescription for testosterone. Like the guy's saying, "I have a prescription. I have a question." And no, you're not allowed. Well, it's a TRT group. Well, if we can't talk about testosterone, what can we talk about? Talk about the weather? Like, what's
food or yeah,
yeah.
like
Yeah. So all I
that's
basically did is I I've kind of personally vetted a lot of physicians that either have demonstrated in the group that they really know what they're doing, or a lot of guys have gone to these physicians and have messaged me saying, hey, like, this guy finally got it figured out. This guy finally got it figured out. So I've made a list of physicians. It's in the announcement section of all the physicians that I say are, if you go here, you're in good hands. And some people say, oh, Danny's posting this because he gets referral fees and he makes money. I make $0. Zero.
Zito.
At zero. My friend Greg Doucette says,
Shout out, Greg.
zero. Who had
Yeah.
a debate with recently too, but I don't make anything. I recently started doing 30-minute paid opinion only
Hmm.
consults because I can't say advice because I'm not a physician. I can't give medical advice,
Right.
and I've been helping guys out. But this is my first foray into actually making a couple of bucks helping guys out. I don't make money with the Facebook group. I don't make money with the YouTube channel. I don't own the YouTube channel. I don't make any money referring people to doctors. If I see a doctor is good, I'm going to tell a person, hey, where are you? You're in Nashville. Well, you need to go see, Justin, uh, because he's got the best place there, and everybody goes there, raise about and go.
Hmm.
And if a doctor sucks, have been doctors I've referred, and after a while I start getting complaints. Well, they're off my list. I'm not going to put my name on that because someone's going to say, well, Danny Bossa sent me there and the guy sucked.
Yeah.
I want to, like, Danny Bossa sent me this guy, and man, he fixed me up. Thank you so much. Like, that's the only point.
Well,
So
it's
I
good to highlight too, like, in the US, I'm pretty sure it's the same in Canada. We cannot profit off sending someone to a
no,
medical practitioner.
no,
It
it's
is
illegal.
highly illegal,
Yep,
and they enforce it.
yep, absolutely, absolutely. No, I make a great living with my business, which has nothing to do with this at all. It's just become a passion of, again, me being in a position where my life was falling apart at the seams. I got it figured out, and I started seeing other people with the same problem. Like, hey guys, like, here's some things you want to try, and learn more and more and more. And I just enjoy helping guys out because I didn't have
Hmm.
that help back then. I didn't have a guy like me back when I was where I was to go to and say, hey, what do I do here? I didn't have that. There was like one Facebook group that was all right at the time, but that was kind of it. You know what I'm talking
Hmm.
about.
It was okay.
It was okay. Um, but yeah, there's guys that just they come in and they're clueless. They don't know how any of this stuff works, and they're starting from zero. So we've got just so much, and it's a shame, really, the amount of posts and comments and advice that's been given in that group that might all get shut down because of
I know.
censorship or whatever.
I love that group. Like, I love you. I'm so glad that I met, you guys, because it's like a brotherhood. Like, I'm a bro, I'm a female bro. And I feel like I have a community of people that understand, the collaborative effort that we're all searching for. There's no resistance, aside from like the arguments outside and everything. But like, you more so, like, you're up front and center against a lot of these people that are thinking it's a cult issue. And it's like, no, like keto and CrossFit, those are more cults than
Yeah,
anti-AI. And like,
yeah,
we're just trying to help. And this is not an opinion-based thing. You have the data. You've talked to the people that are the forefront of the evolved data, even the research before it comes out.
hmm,
They're using these protocols. So,
yeah,
and there's no profit being made off anything. It's just for helping guys. And that's why I love it, because it's being the advocate for, these guys to feel better, because you want them to feel the way you did, or
yeah.
or do
And that's the
now.
funniest thing about the cult thing is, it's like guys, I'm not stupid. I have no need to just say, well, there's a group over there and they all think that purple flying unicorns exist, so let me go and I'm gonna talk about that, and I'll fit in with this little group, and they can be like my bros, and we're this little special group, and everyone else, they're all stupid, and we're like, no, like, I see this all day long. Like, I do this all day long, and it's like what
He
I see.
does.
If I saw that, we're using the aromatase inhibitor. Like, if I saw that, hey, there's a lot of guys that just can't deal with higher levels of estrogen, and they need an AI, and when they do, they get better. Like, that's what I would be saying, because
Hmm.
all the physicians would be saying, like, hey, we got half our guys on and half are not, or maybe they say we have all of them on. If we get them off the AI, like, everything goes horribly wrong, and We don't know why they need to control their estrogen and natural guys don't. We don't know why, but when we do this, everybody's better and their health is better. That's what I would be reporting. Like, I don't care what the answer is. Like, I just, okay, well, what's like, not that the answer is, but I don't care how you get to the end result. The end result is I want guys to feel better and have good health. How do you get there? Whether it's take an AI, don't take an AI, maybe you need vitamin D, maybe you need to take zinc, maybe, I don't care what the thing is. How do you get to the end result? Right
Mm-hmm.
now, right now, all I see is rule number one is stop taking your AI. Like that's literally what it's boiled down to. Stop taking
Mm-hmm.
your AI, wait 8 weeks, call me back, and then we're going to figure out the rest. And we go from there. And then every single time it's like, yeah, I'm better. And over and over and over and over. I haven't had to deal with a guy yet that needed to take one that I got to the end and I'm like, dude, I like
Yeah.
need a
Same.
freaking AI.
Yeah.
Like it hasn't happened. So then they say, well, this is your opinion. Well, I don't know what to tell you. Like I've consulted probably close to 2,000 guys at this point.
Yeah.
And I never had.
If anything, like there are doctors, not the guys in our group, but there are doctors that have an agenda based on who is paying them. If anything, no one's paying you to say this.
No,
So
no.
it's
It's not
not
like,
like, yeah, it's not like, if Arimidex was paying you $6 million, okay, yeah, maybe you would be like, yeah, you guys need to take it. You're like,
yeah.
stop.
There's nobody paying me anything. So what bias am I going to have? Like what's my incentive to put this ugly mug on a YouTube channel and say that you shouldn't take an AI if I knew that it was wrong? Why would
Mm-hmm.
I purposely make myself look like a moron? I'm saying it because I know it's true because I've observed it like thousands of times and you know, so it blows my mind how some people get so freaked out and angry over this thing. I'm like, but why would I say this? Like,
I
find somebody who's sending me a check to make me say something that isn't true, and we'll go from there. But
Yeah, because you're a
it's so frustrating.
contrarian and you want attention. Like, no,
Yeah.
it makes no sense. Did you guys record that debate last week? Is it taped?
Which one?
The AI
The one on
with
that we
Viking.
did. Yeah, it's on their YouTube channel.
Okay.
Yeah, it's on
Go
their YouTube channel.
go guys, go check out that debate. I literally was watching it. I went in my car, watched it while I'm driving, which you shouldn't do. Go to the gym, I'm training, I'm listening to the entire thing. Like it was phenomenal because you absolutely destroyed anything that was brought up there.
It
And
was
it
the
was
channel is
awesome.
called Live Like a Viking. The interesting thing about that debate is I went in heavily prepared, and I'm never prepared for any of these podcast things, but I went in heavily prepared, and I left kind of like my best arguments for the end, right? Because I said, okay, well, let me start with these things and let's see how it goes and see how it goes. And if I need help, then I'm going to go to like my go-tos that this is just going to seal the deal. But then it was like actually kind of like now, like time had passed and the guy's like, holy shit, we're an hour and a half in, we got to close it. I'm like, no, I'm thinking like, yeah, but I haven't got to present like that my best arguments. I guess I wasted too much time going through studies and whatever else. But it's kind of like I was mentioning before, like how come we don't need have teenagers taking an AI? Like it's just
It's a good point that no
how
one can
come
answer.
naturally gifted athletes who have naturally jacked levels of testosterone allow them to do what they do? How come they don't need an AI? They don't take an AI. Or the guys who talk about hematocrit. How come the guys that live at altitude and have hematocrit in the high
Oh
50s?
my
How come they're not
gosh.
donating blood every week? Because high hematocrit's going to make them stroke out. They're not all stroking out. They're all fine. Why is that? Just some basic arguments. Or oh, if my E2 gets high, I get water retention. Okay, well, I'll tell you what. Here's a mild over-the-counter diuretic. Take
Mm-hmm.
that. It's just going to help your body flush some of that water out. Right now, the water's flushed out. Now let's see if it comes back. Oh, it's not coming back, but your estrogen is still high, but you're not getting water retention now. So if
Oh
estrogen
my
causes
God.
high estrogen causes water retention, then how come you have no water retention now? It's not coming back, is it? No. So basically the water retention was just transient, probably because you got on TRT and testosterone actually variations in testosterone can cause water retention, but now your testosterone stabilized, you flush out the water and you're fine. So why do you want to block estradiol now? Oh, it might cause gyno. It's like, fuck my life. Like, holy cow.
Oh my gosh. there's a lot of rabbit holes we can go down. I think we have to do like a part 2 and 3, because, you know, even you reminded me, like the phlebotomy and the hematocrit argument, that's a whole nother half-hour topic too. Like a lot of these misunderstood things are being proven to not matter. And physicians in the group are showing it over and over and over. People with hematocrits of like 65, like they're fine.
Mm-hmm.
You know, everyone's fine. Like, so I don't know that. I mean, honestly, like one of the bigger issues right now is the aromatase inhibitors, because it does like give so many detriments to somebody's healing and their ability to feel the best they can. So I'm glad that we covered that. And I do want people to go watch that debate. And there's plenty of videos on the YouTube channel as to why you don't need to block your estrogen. I don't know how many you guys have done. You've done videos to talk about the videos that you did, like, because it's out of control, because it's like daily someone's like, should I go on my AI? And we're like, all right, is this a joke? Like, are they messing with you? So if people want to reach out and do a consult with you, how can they find you?
Easiest way, if you got a Facebook account, you just look me up on Facebook, Danny Bossa. I get a picture of my wife. She's really hot.
Can't miss her. I love Angie.
You can send me a message through there. If you want to send me an email, just Daniel. My real name is Daniel, but everyone calls me Danny. DanielBossa@hotmail.com. It's my personal email address. You can email me there if you'd like. But yeah, basically on the consult stuff, all I've been doing is guys that are saying, you know, I've got a doctor and he's telling me to do this, but I'm feeling off. He can't figure it out. Like, I just want to run it by you and my past history. And you tell me, like, what would you do in my shoes? And I just look at everything and I'm like, well, here are some things you can consider. You know, you might want to consider, you know, you've got, maybe the guy's got low SHBG and he's only taking once weekly injections, and typically lower SHBG guys will do better with more frequent injections. Like, try splitting it up a little bit more. Or, hey, you know, my doctor says it's high. I'm looking, was free testosterone is like at 15. Like, no, it's not high. You might want to consider trying a little more. But I send basically a disclaimer to say I'm providing just an opinion. I'm giving you you're paying me to provide my opinion based on my experience. It's not medical advice. You still need to deal with your doctor, but maybe you can go to your doctor and say, hey, here are some things that I've learned about. Can we try some of these things together and see what the outcome is? So I'm doing a lot of those. And again, Facebook group, as long as it stays open, TRT and hormone optimization, the YouTube channel, same name. If you join the Facebook group that asks you 3 questions, you got to answer those 3 questions, because my moderators won't let you in if you didn't answer the questions. So.
And you're not on Instagram too much, but sometimes.
I'm on Instagram just to like my wife's my wife's posts. Yeah, my wife's got a at Beach Body Blondie with a Y at the end and not a IE at the end. Yeah,
yes.
Beach Body Blondie. Yeah, go check out her profile. So I go and she posts a lot of hot pictures. I gotta like hers.
I love you guys so much.
And every once in a while I'll go like yours, or I'll hop into some of your live Instagram videos every now and then.
Yeah.
I got a few minutes. Yeah.
Cool. So go look up the YouTube channel, the Facebook group, and if you guys are lost, you can obviously message me and I can direct you towards Danny. Cool. Danny, thank you. We'll have to do this again.
Sure, anytime.
Awesome.